Email us or connect with us on social media.
Change, and together we are unstoppable.
We're really looking for late system overthrow.
We are unstoppable. Another world is possible. We had 150,000 people on the street. That's crazy.
Demand action because it's your entire future.
This is Rogers TV.
Hello and welcome to Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our first guest, I just want to share a few thoughts with you. Here in Grey Bruce, we celebrate that we have entered the green or prevent stage of the provincial reopening framework March the 1st. We are delighted to be green. This change to green reflects the hard work all of us have been doing by following the public health unit guidelines. We also, however, must continue to wash our hands, watch our distance, and to wear face covering correctly to be able to continue to enjoy this broader allowance of activities. However, we face an ongoing concern regarding the possibility of individuals traveling to our area from zones that are red or locked down. The health unit has provided recommendations to businesses, minor hockey and sports teams to help reduce the risk of exposure from any individuals traveling here from out of our region. However, we are also in the green zone in Grey Bruce, being asked by the public health unit to avoid interregional travel except for essential needs, to limit our activities like carpooling, and to continue to limit socializing to those within your household. There is more good news heading our way with the rollout of the vaccine delivery program, and stay tuned for details through news media, social media, news releases about what that will mean for you and for your family, for those who choose to be vaccinated. Thank you for not relaxing your vigilance. We want to continue to enjoy being in the green zone, and we want to be able to do all we can to stay green. The sacrifices we make each and every day are helping to prevent the spread of COVID-19. We are all making a difference. And on that note, I want to introduce our guest today who has made a significant difference in the delivery of services to our region. Francesca Dobbyn, I'm always delighted to have you on the program. Francesca is the Executive Director of the United Way Bruce and Grey, and she's here to talk to us about a variety of things, but most particularly 211. Francesca, thank you for joining us today.
Always a joy to join you guys on Rogers.
Thank you. So 211, I see 211 framed behind you here. I know you've got lots of information about 211 and how 211 is going to help us in these COVID-19 days and has already helped us.
Yeah, we've been really fortunate here in Ontario that we've had 211 for well over 10 years. I know we've had it in our region for, believe it or not, 11 years we've had 211. So when the pandemic hit, that was one of the resources we knew we could activate to share information, to talk to people, to direct people. So let's start at the beginning. What's 211? It's a phone number. It's a number you dial. All you dial is 211, just like 911, but all you dial is 211, and it will connect you to people who are informed about the community, what resources are happening at federal levels, provincial levels, where to connect in the community, what eligibility there is around different programs, other ideas, what's changed because of the pandemic. And we're really thrilled that through investments with both the feds and the province, that 211 is now across Canada as well.
Yeah.
So if you have a family member in another part of Canada and you go, hey, we have this seniors program running here in our region, I wonder if my sister could access it, you can call 211 and they'd be able to tell you whether Nova Scotia has that program now.
Wow, that's amazing. So if I was concerned about a parent and wanted some information about what could be available, just by dialing 211, I live far away, I can still find out in Grey Bruce what's available to them?
Yes, absolutely.
Wow.
Yeah, that's how it works, and that was part of the excitement with the opportunity for with the investments from the federal government to make this a pan-Canadian initiative, because access to information for people through text, through chat, through phone needed to be available during the pandemic.
So who actually answers the phone, the 211 phone?
So wonderful people who have been through courses, they've been through significant training on different things. So they're good at crisis intervention. You know, they're really good. I call it listening between the words, where you think, you know, somebody's calling in because I just need this when what they really need is this. It's totally non-judgmental. It's also totally anonymous. There's no caller ID. They will ask questions about, you know, if you say, here's 6 things you could do to address that. If you'd like, we'd like to call you back in a couple of days and see how it's going, especially around that system navigation. The other joy with 211 is they don't have a get off the phone. There's no minimum. You can't make, you know, a call can't last more than 5 minutes. There's none of that. I have had people tell me I've spent 90 minutes on the phone with 211 making a safety plan for somebody who's experiencing domestic violence, for example. So it's a person. Sometimes, depending on call volume, there can be a wait right now of a few minutes to get to somebody, but that person, you have their undivided attention for as long as you need it.
And that's really important for people who are perhaps in crisis or just so lost, don't know what to do next, to know that they're not being rushed off the phone, that they can ask the questions, get the answers, but also the follow-up. That interests me. The people are, it sounds like 211 is a community connector as well. It's not just information.
Their call center staff are referred to as system navigators. And that's, you know, language we've just brought in the last few years, because that's what they're doing. They help you navigate the system. And that follow-up is, you know, what are those barriers? So if the only service you need is in a different community and there's no transportation to get there, okay, what are the other options? Can they facilitate a phone call? I've had calls put through to me. They've called 211. They have no time left. They're standing at a payphone. They have no quarters left to turn around and make a call to me. And 211 calls me, and we have a 3-way call and talk to that person about what resources and things like that. So it's a tremendous resource for our community.
I would think it really is an important resource for a variety of reasons, but to offload from 911 calls that potentially were not really appropriate for 911, would you say?
That's part of the messaging around 211 is when you don't know who to call, start with 211. If you're not sure what to do, so if you see somebody who's homeless, sleeping in a snowbank, and you're really, really concerned and you don't know quite what to do, it's not really a 911 call. You don't need the police because it's not criminal. But at the same time, you don't want to just leave that person sitting there and you're not sure. And if it turns out, hey, you know what you really do need is 911, they'll help make that call. They'll say, you know what, you do need the police, fire, or ambulance. Absolutely. But often 211 is the better first call around your community and what you're concerned about in helping people in your community. And it takes the burden off of 911.
Yeah. And that's important so that the 911 service is used for those who are in critical crisis situations. 211 is for information resources, which I think is great. Now, they must be getting a lot of calls, I would think, since COVID-19 has hit. Can you talk a little bit about the types of calls, how it's changed, and what they're finding out about the calls?
So the calls are taking a lot longer. People have much more complex needs. There's a lot of crisis thinking. So, they want to make sure the information they're giving the person is understood, and and they understood what the need is and what resources needed. So what we're hearing is that the calls are taking longer, which is totally fine. And people have more complex needs. When we look at why people are calling, income support, food, and housing are those top needs that people are trying to resource. And we have seen an increase in calls, 22,000 calls in 2019 and 26,000 in 2020, because we're just starting to get some of those data points up. So a 20% increase in calls just for Grey Bruce.
Just for Grey Bruce, that's significant, really significant. So we've certainly been talking with other agencies around mental health, and you talked about crisis calls, and I would like to know more about what sorts of things can people expect when they call to. For example, if someone is just so lonely and so isolated and they just don't think they can deal with this one more day, they call 211. What happens? What happens in those types of conversations?
So there may be, I'm just going to caution, there may be a little wait because there is the increase in call volume, but then you're going to get somebody who says, hello, bonjour, 211, how can I help you? And that's up to you then. The rest of it's what you want to talk about. And if they feel that you should be maybe connected to Kids Help Phone if you're a child or a young adult as well, or connected to a different mental health crisis line, they will have that conversation. If you're in that real distress, they will be there. They will stay with you until we figure out what the resource for them to connect you to. There are definitely crisis lines out there. There's 800 lines, but 211 is there. It's there 24 hours a day, 7 days a week, and they are trained to handle those difficult calls and difficult conversations.
And that's important. Thank you for the information. I did get some of the information about the stats on 211, but they are saying that the pandemic has had a major effect on Canadians' mental health, and 76% of Canadians say that their mental health has been affected, because that's a huge increase. What about the people who are unable to pay their bills, aren't sure if they're going to keep a roof over their heads? Obviously that creates additional stresses. 211 is still a place for people to call when they just don't know where to turn.
Absolutely. So if somebody calls in and they have rudimentary knowledge around what's legal, what's happening. So during lockdown, you couldn't be evicted. Now you could be given an eviction order, and that order stands, but you couldn't actually be removed from your residence. But they would know to refer you to your local legal clinic. If you're behind in a utility bill, they'd be able to access and tell you what utility support programs are available out there. So it's always a good idea, if you're going to call 211, have a piece of paper and a pen handy. And that takes a lot of stress out. So if you're sitting there, it's 2 o'clock in the morning and you're stressing about your bills, you can call 211. And although the agency that's going to help you is also closed because it's 2 o'clock in the morning, they will tell you if you qualify, if you don't qualify, what the process is, how it works, how much help is there out there, what they can do, what agencies can't do. And that's peace of mind. Yes. When you know what can and cannot happen to you in the community around those pieces. They stay on top of everything. I mean, I know I send off every time there's a different or a change with an agency of how it's operating. If it's a tweet, if it's a Facebook post, if it's a newspaper article, I send it off to 211 and say, this is what's happening.
Now, United Way has been absolutely a key agency that's been involved with 211, certainly from a variety of ways. Here in Grey Bruce, how you talk about updating the information and that you're also involved with people in distress. What about the food service and also the addictions issues? What are you finding is connecting 211 United Way and this community services? Because those are certainly areas in our community where people are concerned.
So with food, and we'll deal with food first, there's a lot of food programs that are operating differently, but they're operating at a higher rate. And we're really actually now concerned about capacity that, OSHARE 7, 8, 9,000 meals a month is kind of like the most they can cook, just in sheer space and volume and things like that. We've served over 150,000 frozen and hot meals throughout Bruce and Grey during the pandemic. We've tracked that through, I guess 9 different meal programs are looking after feeding people. And interestingly enough, last summer, food bank usage dropped. Part of it was because the meals were available. Part of it was because we had CERB, which was a generous amount of money coming into households and people could buy their own food. And the summer was just a little easier. You got less bills to pay and that kind of thing. And it's just easier to deal with. So there's a lot of food in the system. Our concern is a lot of the funding to support those programs ends at the end of March. And a lot of that covers off staff and it covers off things like the containers, the takeout containers to put the food in. So we have the food, we need the staff to be able to cook it, and we need the containers going for it. And that's a bit of a challenge in that we're taking that back to our funders and going, hey, this was great. This is how many people we fed. Oh, what are we going to do April 1st?
Yeah.
And then on the addiction side of things, that's been a huge, huge concern for that. We have tracked through different metrics how bad the situation is with our opiate crisis. We started a program with Safe and Sound about getting sharps returned to us. And in February, 8,000 sharps were returned to Safe and Sound through that program. And then because we have that information and data, we can go back to the health unit and say, yes, pandemic, but opiate crisis.
Yeah.
And things were reactivated under public health in terms of meetings and resources because we were able to say, you know what, this did not go away.
Yeah.
And if not, if anything, it's getting worse. So we can resource that. And that's where, calling to 211 and saying, okay, I am done with my addiction and I need help is a great first step for anybody who's there and ready for change.
And as you say, sometimes those moments happen not in regular work hours, and they can often happen in the wee hours of the night, and that 211 is there. It's there for people. You mentioned the concern you have about the addictions and also the fact that the funding is ending March 31st, but all of our people, we're not going to be vaccinated. We're not going to be finished COVID. We need some form of interim planning and funding. What are your thoughts about what can be done, what the community needs to do to support organizations like 211 and of course United Way? How do we continue through the next few months to be able to move beyond this interim phase?
So you can do a couple of different things as people in our community. You can always make a donation. We have a pandemic fund. We grant those funds back out to these organizations to support what they're doing. That's how we got some of them off the ground. They didn't exist in March, and they came to us and said, we have an idea, and we said, here, go be awesome. And they were, and they are. And we've walked them through the various funding opportunities going forward, and we will continue to walk with them on that. So if you have the ability to make a donation, you can go to donatetoday.ca or simply Google United Way Bruce Grey or call 211. They'll tell you how to make a donation too. If you want to keep it, if you want to go a different direction, you could find out what food programs are in your community and make a donation directly to them, to those various programs. And again, you can call us and you can call 211. And most of them are all registered charities anyway, so there's always that tax receipt. Another piece is to reach out to leadership in your local community, provincially, federally, and say, okay, what's happening in my community and how are you going to support them going forward? It never hurts to talk to the leadership and say, you know what, I'm concerned that our seniors are going to go hungry. And then, it's hard to volunteer right now. Our programs are at capacity with staff and volunteers. And there is, you can make a donation through your local grocery store with their food bank bins and things like that. There's always lots of ways to support programs in our community.
And I think that it's really important to realize that, yes, we're in green. Yes, the vaccine is coming, but the needs of the people have not changed. And there is a significant community need that's continuing on. We're looking at the positives, but we also need to balance that there are lots of needs continuing. From your perspective, I'm sure going through this journey, what do you do for survival? What do you do for your staff survival? Because we have to think about those who are on the front lines and meeting the needs of those who need. So I want to ask you, how are you doing?
I'm doing okay. I'm definitely looking forward to spring. And interestingly enough, for me personally, when we did the first lockdown last spring, I was in here 7 days a week for almost 4 months. Just helping and writing and grants and reports and blah, blah. So when we went back into lockdown after Christmas and I came in on Monday and I went, oh my goodness, that was boring. What a boring weekend. And my staff all just laughed at me because, of course, that was their experience from the get-go of how boring being in lockdown is. And I just didn't have that experience because I was in here working. And I wanted to make sure they had downtime. And I was like, wow, this really is boring. But I love to walk. I walk our community. We have Bruce Gray is beautiful. Public health, absolutely. Get outside, go for a walk, socially distance. Around our building or with the staff that are in here, we're at half capacity, half are working from home and half are in here. We take time to laugh. We take time to joke around. We take time to find joy throughout the day. And if something goes really well and really right, we just celebrate it. We have a couple of events going on. We have our Pie Day event. So the other day we sold out all 50 pies. And that was kind of a celebration of the ridiculousness of doing such a silly thing. So we take time to play. That's really important for us as well. And we take time to listen and what's going on in each other's lives.
Yeah. So you connect with each other, even without dialing 211.
Absolutely. We connect with each other. And when, if it's Karen who deals with our utilities and she hears, this client's got some extra issues, what do you know about? Who can we connect them to in the community? And we're working on a conversation we're having around senior support. And, I had 3 or 4 organizations all separately contact me and say, we're thinking of doing this. And I'm like, let's get on Zoom. And I introduce them to each other. And, what are you bringing and what are your needs and what's the capacity of the people that you're helping? And you'll start at a conversation. I used to say, Night Away doesn't do too much. We make a lot of coffee and we can't make coffee now and bring people together around a table. We can do that on Zoom. And then, if we have somebody who thinks, oh, the seniors are this far along in understanding technology and no, they're not, they're here. And it's like, okay, so how do we help? What do we need? And it goes from there, and it's wonderful to be part of those conversations.
From the first lockdown, the second lockdown, and now we're moving into green, what differences have you noticed, and what are your reopening plans? We're looking to the positive of totally opening up. What will United Way look like? Will it be different?
I think we can't go back. I think society is going to be totally different going forward. That's just going to be the nature of the pandemic, of what we're dealing with here. You know, at some point when we have herd immunity and everybody's been vaccinated, all staff have been vaccinated, we'll open our doors to welcome people back in to sit down and have meetings with us. That will be on our agenda. We're doing our best we can. If somebody has to get photocopies of things for, you know, we'll do it at the door. We expect as a society we'll be wearing masks for a long time out of just sheer respect around, like, you know, we talk about the regular flu being less. Well, that's because we're washing our hands and we're wearing masks and we're doing those things. But I really am looking forward to a really nice warm September day when all the staff can come together. We can have a lunch at a restaurant. You know, we could be outside on a patio, but we can get together and just talk about the dogs and the kids. And there's some kind of return to that new normal.
Yeah, where COVID-19 is not the first topic in a conversation, where maybe,
Yes.
yeah, where it's just not the primary thought, because it has definitely been first in mind for a long time for people, understandably.
Yeah, we're involved with the Safe Communities Committee up the peninsula, and we've done a lot of work around stunt driving over the last 5 years. And, you know, we've picked up that conversation again going into the tourist season of what we're going to do about stunt driving. And it's like, oh, something else to talk about.
Yeah, yes, exactly. So I'm wondering if before, you know, we're moving towards the last part of the program, is there anything that you'd like to share that I haven't asked you, or anything you'd like to talk about relating to the community safety and well-being plan and the initiatives going forward?
So I think the only thing I would say around community safety and well-being is we've got a lot of amazing partners already around the table, already doing the work. So we've highlighted a couple of poverty issues, housing, addictions and mental health. Those tables exist. Those groups exist. The partners exist. We need resources. We need to understand what the issue is. You know, the housing crisis, you know, we've been screaming for 5 years about where we are now. And we saw it coming, and we've been trying to talk about it. And we're finally actually having those conversations about when suddenly the middle income people can't buy housing. And we've got this exodus out of the city now that we can all work from home, pajama pants notwithstanding. You know, what's that doing to our housing infrastructure? Where are these subdivisions that need to be built? And it's okay that they're not necessarily low income housing because it moves inventory, and we need inventory. Like, we're at an inventory crisis, not just a general housing crisis. So, you know, people are working on all these issues already.
And I think that's really important for people, because these things do take time. They take time for the awareness and then take time to get the action. But the need will be there for sure. So United Way hopefully will be able to receive additional funding, hopefully, to be able to help throughout the transition before we're able to totally reopen. And that's the key message. We need for your organization and all those support organizations to continue for our community support, for sure. So Francesca, 1 minute left. Anything to add?
I just want to thank everybody. I want to thank people like yourself for your leadership, the Rogers team for getting this information out. It's a great vehicle for being able to talk to people in our community, and all the donors that have supported all our initiatives. It's been tremendous, and, you know, our hearts are full.
And certainly from the community's perspective, I am awestruck by the awesomeness of the generosity, the ability for people to communicate, and the willingness for people to connect. So, you know, I want to thank all of the organizations, especially United Way, because you unite us together to be able to find the way. So certainly, you know, I think there's more work to be done, but together it will move us forward, I think, into good standing as we are able to move through COVID. Thank you, Francesca. I know you've got another meeting to go to almost instantly after this one, so we appreciate your time in being here today.
Thank you.
I also want to thank our viewing audience for joining us here today. Please join us again to learn more about services, programs, and resources available to you and to your family. Please take care of yourselves and stay safe. Thank you.